As many of the listeners to this may know, CAR T-cell therapy is an area of major excitement for the myeloma field, and I think it could potentially be transformational. And the data that we've seen so far, mainly presented by my colleague, including work presented by my colleague, Dr. Raji, shows that in patients who are heavily treated patients that you're able to achieve a complete response rate of over 50%. I think it's quite remarkable. I mean, these patients have been through all our standard therapies, and they're really looking for the next treatment. And for a treatment like chimeric antigen receptor T-cell therapy to achieve a response like that suggests that this therapy could potentially be very transformational for patients who have such heavily difficult to treat disease. And I'm going to argue that we should start looking at this therapy at earlier in the patient's journey rather than waiting until the very end. Because there's a school of thought in the myeloma therapy that we should start thinking, rather than saving the best for last, we should start thinking about using effective treatments earlier in the course of therapy. And we can see examples of this, for example, with other therapies that we already use in multiple myeloma. For example, therapies such as daratumumab, which are effective at relapse setting, but we found that when we use it earlier lines of therapy, we see that the treatment can be more effective. And there are other examples of how, in real-world practice, that we find that many patients over the course of their journey aren't able to get to that next line of therapy because they're developing comorbidities or have other complications. So I think that when we have such an exceedingly effective therapy, we owe it to our patients to start looking at it in earlier lines of treatment. And in particular, I recognize that CAR T, it's investigational, it's not a perfect product, it's not a perfect therapy yet. And that's why I think if we are looking at it in earlier lines of therapy, we need to do that in the context of a clinical trial. And in particular, the patients who I think would be a good fit for this type of treatment would be patients who have an early relapse. And we know that patients who relapse early following initial therapy, those patients have a more challenging course and have outcomes that are not as good as compared to the rest of our patients. So I think for those patients, we should look at using CAR T therapy for those patients. And we are participating in a trial called KarMMa-2, which is designed to answer that question exactly.